Hi, thank you for joining us for today's webinar and communication breakdown practices in airport emergency plans. I'm Beth Olson with the Transportation Research Board. At the end of today's webinar, you'll be able to identify successful AEP practices implemented at airports at various types and sizes, and determine how to operationalize successful AEP practices at your airport. This webinar is eligible for 1 AAE credit. As an attendee, you're automatically muted when you join the webinar. However, you may ask questions by using the control panel, which should appear on the right-hand side of your screen. The questions that you type in are not visible to the other attendees. They're sent directly to TRB and the moderator. Please type in any questions you have about troubleshooting software or audio, as well as questions about the presentations here. You can type in your questions at any time, and after all of the presentations, we'll read the questions out loud and have a conversation to answer the questions that come in. After the webinar, you'll receive a follow-up email containing a link to the recording of today's session and another link to the slides. I'd like to introduce today's moderator. Scott Corzine co-heads the Compliance, Risk, and Reliance Practice at B. Riley Advisory Services. His focus on operational resilience has led him to be principal investigator on 2 ACRP projects. One is on cloud-hosted airport emergency plans and one on airport business continuity planning. Scott has also served as a panelist on 2 ACRP synthesis projects, one of which was the project that will be described here today. So Scott, over to you.
Yeah, thank you. Good afternoon or good morning, everyone. Glad you could join us. We appreciate your time. My first job is to remind you, for those of you who may not have been involved in an ACRP project, there's lots of ways to get involved. This really is a community-based platform. So you can see here the ways you can become involved. You can join the Idea Hub community. You can volunteer, as I did, to be a project panel member, which is really helpful. Having been on both sides of these projects, it's helpful to have a terrific involved panel. You could write a problem statement, a research proposal called a problem statement, if you sense that there's something in the airport industry that needs to be researched and brought out to the community. You can answer a survey. Lots of ACRP surveys come along. And then, of course, you can apply research results to your airport if they meet some of your needs. So we encourage you to get involved. So I'm pleased to introduce today's speakers, Stephanie Murphy and Michael Tobin. They're going to talk about some results and findings that came out of Synthesis Report 115. Stephanie is a certified emergency manager. She's vice president with Tidal Basin Government Consulting, and she's been an emergency manager for over 20 years. Before Tidal Basin, she was the emergency manager at Metropolitan Washington Airports Authority, which is a big one, and built the emergency management program both at Dulles and Washington Reagan airports. Before that, she was at FEMA, with the U.S. State Department, and with some local municipalities in Arlington, Virginia, and Orange County, California. So she brings a terrific background in emergency management to this program. Michael Tobin, who's joined us from my hometown airport, he is the emergency operations manager at Charlotte Douglas International, which I didn't realize is the 6th busiest airport in the country now, and serves as American Airlines' 2nd largest hub. Before coming to the airport in 2018, he worked at Charlotte Mecklenburg Emergency Management Office and the Charlotte Fire Department. So he's a Tar Heel and a Charlottean, born and bred. Welcome to you both. Next slide, please. Thanks. So just a little background on the Synthesis 115 project. I was honored to be on that panel. We were thrilled with the work that Stephanie and her group did. Chris Bidwell from ACINA was on the panel. As you see, Tracy Clark from Allegheny County Airport. We had a couple of consultants as well on the project in addition to B. Riley, Terrence Daly, Paul Cara, and Brandy Welsh from consulting firms. Mark Tunnicliffe, who many of you may know, was the FAA liaison, and Megan Smalley from Jacksonville Aviation Authority. So it was a good panel. We really enjoyed the work. And with that, I'm going to turn this over now to Stephanie to take you through the process.
Thank you. I appreciate it, Scott. So as you said, I'm Stephanie Murphy, and we're going to talk about a few things today specific to AEP practices, but really how there are many means and methods that you can employ that will help end communication breakdown. And we're going to talk about 10 specific ones that were found during our synthesis report. So, we know that airports prepare to respond to emergencies through various means and methods. And among the many forms that preparedness has taken, one method obviously is developing and updating an airport emergency plan, or the AEP, which for many, many airports is required by, and we'll talk through this, right? Title 14 of our Code of Federal Regulations, so the CFR, it's Part 139. And then we also have the Federal Aviation Administration's Advisory Circular, and that's AC 150. And the last time it was updated, gosh, was 10, 11, 12 years ago. So it's been a while. Knowing we also have a recent update with the UAS aspects. But the AEP is meant to support airports in defining their roles and responsibilities, not only of themselves, but in many other stakeholders during an emergency. And they want to be able to identify those specific threats that could affect the airport and make sure that we're establishing communication protocols for the entire airport community. You'll hear me talk about community. And when I say that, it means those at the airport, not just the airport employees, but our tenants and our federal partners and the airlines. It also can mean the municipalities that support us, whether it's at the local level or the state level. So that's really the involvement of the airport community. And, we know that airports are using the AEP as a foundational plan for all of this required information that's outlined in the circular. But throughout the synthesis, we found that a lot of airports are finding innovative ways to communicate and exercise their plan. So as they really start to encounter emergencies of different sizes and types and complexities beyond the airfield and aircraft accidents, our airports are finding themselves in need of plans that seek to manage all types of hazards and threats. So for this webinar and for our synthesis, we asked the question, what is an AEP practice and what does that really mean? So we talked about it as an activity pertaining to the AEP that accomplishes the mission, but also assists with the development and upkeep of that AEP. And so it can include a lot of different things, training of our stakeholders or exercising of those plans, and then also creating other plans that can close gaps that we've identified through hazard assessments or threat assessments, as well as identifying and outlining good communication methods. So these are all things we're going to talk about today, and we'll get to sort of the top 10 things that you can implement, or take certain aspects of those that you can implement at your airport. So the research problem really talked about that in this day and age, our airports are dealing with emergencies of varying sizes and types and complexities. And so they are finding themselves in need of plans that manage all types of those hazards. So as part of our synthesis, we approached gathering the data and information 4 different ways. The first way was we reviewed relevant literature on the topic. So we gathered all of those doctrine aspects, whether it's the circular, whether it's understanding FEMA guidance or national doctrine when it comes to emergency management. We also looked internationally to just gather that information to level set what it is that is important when it comes to emergency planning, especially at airports. We then held an in-person plenary panel discussion at the AAAE, and we had about 175 attendees during that session, and we asked some general open-ended questions and captured the answers that were coming back from those attendees. From there, we sent out a survey to 81 different airports, small, medium, and large, as well as general aviation. And we got a great response rate at 72.5%. So a lot of really good data came in from that. We even further talked to 7 airports, some medium, some large, and then a few that were general aviation, to really hone in on what were some of their successful practices when it came to AEPs, and how did they really work towards breaking down those communication barriers. And so my goal is going to be talking to us about one example in particular about how he went about doing that at his airport. So the overarching findings for AEP practices, you can see this here. We recognize that airports use the AEP as a foundational plan. There's sort of no getting around that. It's required if you are a certified airport, so it's used. But I think the ways beyond that vary. So a lot of airports are using innovative ways to communicate information. We'll talk about that a little bit later. They do they make an active effort to incorporate lessons learned. They do try to develop plans to fulfill perceived gaps or identified gaps. So something that may not necessarily be appropriate to include in an AEP, but that they've identified as a gap, a threat, a hazard, they might develop a plan specific to that. They'll also manage those new and existing threats and hazards using some various AEP practices. And this again could be an example of the UAS. These are some new threats and hazards that airports are experiencing. They'll also enhance their existing AEP through development or enhancement of their all hazards plans that they have within the document. We also found that some airports are using capabilities-based planning efforts to foster good communication, and we'll talk about that in a little bit. Some are also using review committees, so actively engaging their stakeholders to come together for the AEP. They'll be using checklists as well as developing reference guides, all in an effort to help. So as we look to implementing these practices, I think it's really important to understand that obviously airports maintain their AEP to the regulation standard, but then some focus on various aspects such as the development piece, training exercises of various elements to different levels. There are, again, the requirements of the triennial every 3 years that have very specific requirements. But each airport handles it a little bit differently, and we found that traditional emergency management practices are being incorporated into these programs, and we're placing a nice importance on gap and threat assessments to help the overall program and formalize the emergency management aspect of what airports are doing and specific to AEPs. So we're going to talk through the top 10. So this is the first thing that we determined that I think is very helpful generally for our airports is, airports have creative, innovative practices to ensure that the relevant plans that they need, that are necessary to respond and recover from these threats, are able to be accessed, are available. And so one way they do that is there's an ACRP AEP builder tool that was developed, and this can be for the smaller airports that maybe don't have time or a lot of people. I understand a lot of AEP management is an other duty as assigned or an ancillary duty. So there is this builder where you would input information into the questions, and it would pop out once you hit submit, it would pop out the AEP plan for you. So those are some innovative things. That's an innovative tool that's available. Some airports are instituting smaller drills on key aspects that support the overall AEP process, and looking for ways to incorporate these types of drills into existing meetings, perhaps, or existing groups. So if you have airport groups that meet on a monthly basis or on a quarterly basis or on a bi-weekly basis, taking the time to have a drill or a safety moment or a piece of the AEP that can be discussed so that it's always fresh in everyone's minds. A lot of airports are using experts, whether it's a consultant or if they are a part of a municipality, they're looking to their other government employees to help them write specific plans. So an example might be One of the airports, Centennial, hired a media and communications manager to write the procedure for their communications plan. So it's using things like that, as well as making sure that you have perhaps working groups. And we'll talk about that. Making sure that you have those stakeholders a part of it, not only on an ongoing basis, but then start to incorporate the ACRP, the AEP aspects and tools into onboarding for new employees. So those are some things that people are doing. Then they also have really found that engaging stakeholders internally and externally to the airport has become a vital component to successfully developing and having stakeholder buy-in to the AEP, because a lot of our partners are going to be there with us as we respond. So, you know, we had some airports who talked about they utilize the what's in it for me aspect to communicate information to those stakeholders. And what that means is helping those people understand why it's important for them to understand the AEP, as well as how it's going to benefit them, having a knowledge of it, participating in training, participating in the exercises, so that when the response actually happens, everyone is better prepared. You're also going to want to make sure your policy group is included. And when we say policy group, that's typically senior leaders or executive leadership. Oftentimes we find that they have a very limited understanding about response, and that leads to a lot of questions and information that they need. So the more opportunities we have to include them in these processes, the better off that they will be to understand how we respond, what kind of information we're gathering, and when they would be getting the information on a regular cadence if we were to experience an emergency. We also highly recommend including local jurisdictions or your municipalities in your AEP development. One thing this can do, especially if you utilize the public safety departments from that municipality, is get their buy-in, or also start to understand if they have other plans to deal with aircraft accidents, to deal with issues in the terminal or landside, and you can start to come together to make sure that when you do have a response, you're not missing the mark with each other. Again, breaking down those communication barriers early and often. So another item that we found in this synthesis that's great to implement at your airport is making sure that you're exercising and training on the plans, you know, that you have, and maintain that stakeholder engagement in the development and maintenance of those plans. So as you can see here, here's an example of putting together the emergency management training recommendations. And I think presenting that to your stakeholders early on helps them understand what is expected of them. So you can see the different levels of training, and that oftentimes is based on positions or what people would serve within an operations type of center, whether it's an emergency operations center, so EOC, or if they're within the airport operations center, AOC, or joint operations center, a JOC, whatever it might be. There's various levels of training that we want to make sure people have. And then we might go into tabletop exercises or those full-scale exercises where we're actually on the airfield or in the terminals exercising these things. But making sure we've identified what people should be trained on is going to be incredibly helpful. Then we have other people that should be involved. So what this is showing you is, based on our data, there was a lot of different stakeholders that have been included across the airports in their AEP process. And bigger the square, the more often that that type of group was selected as part of being the AEP process. So we want to make sure that you're including folks, not only from your public safety department, but that you're including obviously airport operations, if you have landside or airside differences, federal partners, airlines, all the way down to consider NTSB to hear what they have to say, and any things that would be helpful to include in their AEPs, in the AEPs, because they respond to airports. We know this. They respond to the aircraft accidents, and They might have some lessons learned about what could have been included or how to best exercise certain elements. And you also want to make sure you're including your corporate offices or taxis, TNCs if you have them, so the transportation network companies, that's Lyft, that's Uber, if you have an administration side. So these are all folks you want to get buy-in internally and externally to the airport to be a part of these AEP practices. You don't have to have them as part of the full complement of an AEP update perhaps, but it might be best to bring them into some aspect of the planning to get their thoughts on what would they want to know and what aspects would they want to see in their AEP. One of the best things that an airport can do is establish an after-action report and improvement plan process. And this can help improve the AEP and any supporting documents that you might have. Especially during COVID, this is a long event and it's still ongoing. And Michael's going to talk about this a little bit later. They created their communicable disease plan before COVID. They've learned a lot of lessons, and now they're at the point where they have appropriately reached a mark where they should update their plan, and they are. That's what they're doing. So making sure that you have a process in place so that you can pretty quickly capture the information from an AAR. And when you put this process in place and you socialize it amongst your stakeholders, what you'll start to see is that they'll think through these after action items even before you call a meeting together. I have found that teams who put a process in place and talk through it often, you find your folks who are responding start to write down areas for improvement, the lessons learned, best practices, so that they're ready to talk about it when you go through that after action process. It's very hard after 2 years or a year and a half or a year or 6 months to try to remember all of those important details. So helping people understand that a formalized AAR and IP process is going to happen, you can really help yourselves by capturing the needed data as you go along with it. All right, so now these innovative AEP practices. So some of the things we want to do is involve SMEs, so a subject matter expert. We want to maybe create stakeholder books. I think of it as a Cliff Notes version. Some of our stakeholders only need to know certain things that's within the AEP, not because it's confidential to them, but because for their role and responsibility, they only need to know certain elements. So taking the time to create those stakeholder books is a very successful practices that some of those airports we talk to are doing. We also want to think about creating an AEP review working group. And this can help with that stakeholder engagement, help bring people together to communicate on a regular basis. Again, that breakdown of communication happens when we're not talking, or we're only waiting until the disaster or the emergency or the accident happens. So we want to see about implementing these things early on and utilize them. You know, it helps people understand their roles and responsibilities. You know, what is it that I think I do? What is it that my friends think I do? What is it that perhaps my boss thinks I do? But what is it that I actually do? And right sizing for yourself or whomever the stakeholder is, what those roles and responsibilities are, I think will be really important. So these are some different ways you can do that. And then including, again, those experts that are external to the airport, not just internal subject matter experts. We also understood that airports dealt with a lot of challenges when it came to the AEP. You know, a lot of folks talked about the AEP in its current iteration. It's not as user-friendly as an airport would want. And, you know, there's the different thoughts of what should be in an AEP and what shouldn't be in there. And this can create an unwieldy document that is very large and takes a lot of time to update and maintain, because the document can be prescriptive or inflexible or perhaps rigid and takes a lot of time to get approved. So one way we can help with that is doing some of these other things, right? Having these review panels early, so we're doing small incremental changes, that we're understanding what things are repetitive within the AEP and flagging those. So perhaps as we continue to update, we can limit those repetitive areas and maybe format the plan a little bit differently if the airport wants to do that. You know, and not every airport has an FAA inspector who wants to see it in a different format than from what the circular says. So there's also dealing with that regulation aspect. And then also the time. If it's an other duty as assigned, an ancillary duty, there's a lot of other operational things that happen, and updating the plan, especially one that is large, can take a significant amount of time. So we just want to make sure that some of these AEP practices we're talking about are implemented, because it can help with this aspect. One of the other really important things as well is aligning and crosswalking multiple plans at the airports, or plans that could affect the airport developed by the surrounding municipalities. And we want to make sure we deconflict, right? So we want to ask ourselves, is one plan saying we're going to turn right while the other plan is saying we're going to turn left? And so by taking a hard look at what are all the plans that are out there that deal with the airport, whether it's airside, landside, the terminal, secure areas, way out in the parking lots, corporate offices, municipal plans, we want to make sure that, like a puzzle piece, we're fitting those together to complement each other and they're not conflicting. So that takes time, but it's one of the more successful practices. If you do it early on and you build those relationships with the airport community to deconflict those plans, you'll have a better response when something does happen. The other thing we know is that airports can benefit from using a gap analysis, or what we call a THIRA, and that's a threat and hazard identification and risk assessment process to understand what gaps there are in planning. So there's the current state where we are, and we may or may not be happy with that. We may have the AEP in just the right place, but we don't exercise it enough, or perhaps there is leadership intent that is asking us to do more with it. So there's that desired state. So we do this gap analysis and we identify what those key steps are to close that gap. What do we need to do? Do we need to create plans? Do we need to do more trainings, exercising? Do we need to hire people? Do we need to break out specific aspects of the plans? But the bottom line, as we go through all of this, even though we don't always have a crisis, we want to make sure that our stakeholders know the plan and that they know their part. So in identifying those gaps and whatever we create, we still want to make sure that those stakeholders know the plan and that they know their part. So through all of this, there are some enduring challenges that the airports experience. And sometimes it just doesn't matter how many groups you put together, how many trainings you might do, how many exercises. There's just certain things you may consistently run up against that is an enduring challenge. And that can be time, that can be the standards, the advisory circular, standards and regulation. It can be competing priorities that are focusing on different things and not emergency management or the AEP. It can be different perspectives. Some people utilize the AEP in its current form to include absolutely everything, and others just do the bare minimum and then create supplemental plans that speak more in depth and are more like an SOP. So these are just some of the things that airports deal with. You know, their current practices versus current standards. Do you have the ability to say, here's what we actually do? Does that agree with those standards? And it should. The AEP should be flexible enough and all hazards enough that you're able to identify what your current practices are, and these should constantly be updated because we're always responding in better ways after those lessons are learned. And that's why it's important to have these groups together to look at the AAR and decide, you know, here's areas for improvement for us. The other enduring challenge is the size of the document, right? We've all been there. I was there and supported the AEP update that the operations folks managed at 2 major airports. And these documents were huge, 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 huge. And it's a challenge to go through them. But as they say, you just take one bite of the elephant as you can to just get through it. You also have these varied perspectives. Sometimes this becomes an enduring challenge that they just don't think that AEP should be anything else beyond what the advisory circular says, whereas somebody else sees the potential of where it could be and the growth it could be. So that becomes an enduring challenge. One of the other things we have found is as we look to professionalize airport emergency management, that sometimes means there's a transition from airside operations to more of an independent emergency management group. Sometimes that reporting straight to chief executives. It could be within public safety, so police or fire, or it could be housed within airport operations. But there is still the active pull that moves from the operations aspect into emergency management. And that can just cause challenges as people go through it. And then also who owns the update of the AEP, right? Who's responsible for updating it and maintaining it versus who's the owner of actually responding and applying it during an actual event. And then last, that stakeholder engagement. Sometimes it can be really hard. You might have folks who really believe in updating the AEP and participating in training and participating in exercises, but you have others who don't, and that can ebb and flow as well. You may have an airport manager who supports it, and then that person retires after 2 years, and you get somebody else in who, who does or doesn't. Again, it just becomes some of these enduring challenges. But if you look at those 10 items we talked about and implementing them at your airport little by little, you can overcome some of those breakdowns, not only in communications, but with some of these challenges as well. So what we're going to talk about now is Michael's going to go over a very specific case study where him and his team created a communicable disease response plan, and he'll talk about his process and what they're doing with it. So Michael, the floor is yours.
Thank you, Stephanie. Thank you, Scott, for the introduction as well. Good morning, good afternoon, everybody. Hope everybody's well. So I'm just going to briefly talk about, as Stephanie mentioned, our internal communicable disease response plan for Charlotte Douglas, how the plan started, where we are with it, and where we plan on going with it in the future. So the original plan was written in 2015 with an initial update in 2017. And as you saw from an earlier slide, I've been, I guess you could say, fortunate to look at the plan from 2 different sides. One is the local emergency manager working for the city and the county, and then now working as the emergency manager from the airport. And certainly from the airport's perspective, it's vastly different than when you're looking at it from the local EM perspective. I think there's more, or at least in my opinion, more ownership to it. You want to make sure everything is actually exactly how you want it from an airport's perspective, but also knowing what your resources are from the local community that can come in and assist you as well. So we have a current plan. We conducted a more comprehensive update in the fall of 2018. And that was actually led by Mecklenburg County Public Health and their preparedness coordinator, who took on that initiative. And it was for us a tremendous help with that. Somebody with a public health background and actually can understand both sides of the fence from the public health and then from the response agency of what that plan needed to look like as we improved it in those short couple of years. And then fortunately for us, it was completed in March of 2019, approximately 6 to 7 months before what we know is COVID now really became prevalent in our community. So I think for however it worked out, we just got a good head start on it. But as Stephanie mentioned earlier, we've learned a lot from it as well over the last 2 years. and that's why we're going through a update process now, and I'll talk a little bit that in the future. But that's that's where we are at this point. You're fine, Stephanie. Go ahead. Thank you. So these are some of the initial stakeholders with the plan. Obviously, us as the airport, North Carolina State Public Health has an overarching agency. They can put in some local laws and some state laws when reporting public health emergencies, and that certainly gives the plan a little bit of teeth that we're looking for. Certainly, Customs and Border Protection are a very essential partner with that. They have a station here in Charlotte. Obviously, we have numerous international flights that come through Charlotte, so CBP is a tremendous partner. They actually have their own small quarantine room down in the FIS section of the airport so that they can handle anything as cases come across, and it gives us a good starting point to where we need to start from and work from there. Local city county emergency management, obviously they're the partners that bring everybody to the table. They have a tremendous depth reach back to state emergency management for additional resources, and they're really that coach, if you will, that kind of rallies up the team, and we get moving forward with that. And then come the response agencies, the actual boots on the ground with the Charlotte Fire Department, with our ARF assets here at the airport, but also our city companies as well, that depending on where the incident is, what resources are needed, it's not just an ARF event, it's going to be additional resources coming from the city to support it as well. So we want to make sure they are all on the same page. As I mentioned earlier, Mecklenburg County Public Health, they're going to be our initial call to let them know what we have going on, and then the call tree starts from there with involving the CDC and the local hospital systems and our EMS agency that serves the city and the county. We're very fortunate to have them on board here at the airport, and they provide us 2 teams internally to the airport every day. And they're the ones that are going through the terminal and the golf carts, and really they're the ones that are going to be the initial provider and have patient contact as early as possible. So having them on board, making sure they understand how the system works, because it's different from an airport's perspective. It's different from an airline perspective than if you're just responding in the local community to something else. And then our 2 large hospital systems, Atrium and Novant, many hospitals specifically within Mecklenburg County, but also the surrounding counties as well. So if we do have a large outbreak or multiple patients, how those patients are going to be spread out across the network, so we can track them, get them the appropriate care that they need, and then certainly the CDC and local public health can follow up those hospital systems moving forward. So our updates and discussion items were held in person. Again, this is all pre-COVID, so it made it a lot easier as opposed to going to virtual meetings. But having those meetings in person, informing the stakeholders and the partners what we're doing, what the goal is, how they can help, and also for documentation review, giving them parts of the plan as we work through it for corrections, additions. Yes, this needs to be in the plan. No, it does not, and have those conversations very much openly. And as I mentioned earlier, the CDC, none of this would have been possible without their assistance. Fortunately or unfortunately for us, depending on how you look at it, we do not have a quarantine station here in Charlotte. Our closest is Atlanta. That is only 3.5 hour car ride down Interstate 85. So they could certainly be here very quickly if they needed to, but a lot of that is all done through communication networks, telephone, virtual conferencing if we need to. But they are a huge champion partner in this entire process. And if you have not reached out to your local quarantine office, I would absolutely do that to get them on board. They can certainly help in the process, really from A to Z and everything in between. They are the subject matter experts, and it's their responsibility through the airlines to get this information, see what they need to do, how they're going to inform the local response agencies, and that's really the kickoff to the event, is getting them involved. So if you have not reached out to them, and as you work through this process, if you already haven't done so, please do so. They're a great champion. And then the last part here is, as I mentioned, they're close by. So we were actually able to bring the CDC and the Global Migration Office to Charlotte for 2 days of meetings, so they can, in person, it's one thing that, if I tell our stakeholder partners, hey, this is what we're doing, I need your help, I need your assistance, everybody's like, yeah, okay, we'll get to it, and it is what it is. It's a good partnership. But when you have those subject matter experts physically in person talking to your stakeholders about what this plan is, what it means, how they can help. That is, a huge win for us. And they were able to come up and talk to our stakeholders, our partners, and even our public safety agencies. And you'll see a little bit later on in the slide deck what that looks like. But again, for them to take the time to do that, certainly being pre-COVID, that they had more availability to do that. Now, probably not so much, but I'm sure they can make arrangements virtually if that's something that you're interested in doing. So that's one of the doctors from the CDC. She was actually speaking at our public safety or our security cabinet is what we call it locally. And that's made up of all the law enforcement agencies that are here at the airport, our local airport law enforcement, TSA, CBP, our EMS agency, our fire department, corporate security from American Airlines and others, to give them a higher level overview of what this means to their operation and how they can be a part of it. So having the doctor there really speaking firsthand to these individuals, again, was a very good win for us. And then we did a little bit of a walk and talk. In this picture here, you'll see on the right in the white shirt was our medic operations supervisor, who does special operations, which falls under the airport, falls under that umbrella. And then the two in uniforms are from the CDC, and then Martha Edge, for those of you that know Martha, at the time was our terminal operations manager. And we just gave them a little bit of a tour of our facilities, what our EMS carts look like, how they respond. And it's one thing if I tell them, hey, this is how medic's going to respond, this is what they're going to do. But when they hear it from the actual agency, and they can really talk shop on the medical side and containment and any other things that they need to do, that worked really, really well for us. And that was, it was a 15-20 minute hall conversation, if you will, but it worked out very, very well for both parties, and they really enjoyed seeing what we have to offer and how quickly we can respond to those incidents and really get word to the CDC in a very quick and efficient manner. Again, as I mentioned earlier, the plan was officially signed off. We had, I think it was 6 or 8 signatories to the plan, department heads that really, at the end of it, made sure the plan was exactly where we needed it to be, that their agencies understood the plan, that they will be accountable for their agencies and making sure that they do what they need to if and when called upon. Again, I mentioned earlier, we finished this up with COVID, late 2019, early 2020. We were less than a year from the plan really being updated and working on. And yes, the plan is great and people love it, and they'll thumb through it really quick and then they'll put it on the shelf, and they probably won't look at it again until there's an incident or until they get an email or a phone call from me that says, hey, it's time to review the plan. But I can assure you that those plans were very much dusted off early in 2020 when all this was happening, so that we could really look internally. Do we have everything we need? Do we have a good solid plan, regardless of what the actual communicable disease is? And that was really our starting template for COVID. We did make some changes throughout COVID response of how we respond to things. And these are things that we probably would not have known had there not been this type of communicable disease in the community. So it really helped us out updating the plan, and that's the process we're going through now. And then in very short order, in March of 2020, we put together a tabletop exercise. Once we really knew that COVID was here and was going to be here for what we thought was a long time, and having a physical tabletop exercise. Again, this was pre-mask, pre-social distancing, if you will. So we put, over 100 people in a conference room and, worked through this plan, not knowing several months later, yeah, you probably shouldn't have all been together and you probably all should have been wearing masks. But, at the time, we just didn't have that information. So we pushed forward. But it was very nice to see all the different stakeholders and the partners physically walking in the room and having that plan in the 3-ring binder, walking into the room and making notes, making changes as we went through the plan, and actually them referring to the plan as we went through the tabletop. So that was I think a good success on our part. Again, as we did the tabletop, it was used as a reference to assist agencies in making their decisions. And they had to reference any of their SOPs or SOGs that they had internally that's not part of the plan, but whether it's an airline or a response agency, did it meet their needs, their goals, or things that need to be changed on our end or on their end? So it was really a very good work in progress as well. And then we also use it during some real world incidents. As I mentioned, Charlotte has many, many international flights, certainly through American Airlines, Europe, the Caribbean, and then we have Lufthansa as another large partner that provides flights to Munich every day, and then Air Canada as our second foreign flag air carrier. So we do have a lot of flights every single day. They're coming through CBP and going through that process, but it's it was just interesting to see how all this evolved over time. And as I mentioned earlier, there were some things that we did internally where prior to COVID on a EMS response, and you saw those golf carts in the earlier slide, that if that patient had to be transported to the hospital, they would load them up on the cart, they would drive them down the concourse, through the terminal, back through the ticketing lobby, out to the curb to await the transport unit to transfer them in the hospital. And then once COVID happened, we're like, yeah, it's probably not the best idea to, spread patient whatever they have to other passengers. Plus, it doesn't have a good look and feel to it. So we totally changed our response on how passengers who have medical emergencies and when they are in need of transport to a local hospital, what that looks like. And they don't go through the terminals anymore. They don't go through the concourses. We find the nearest elevator, and we've already mapped it out, and we bring them right down to the ramp. And that ambulance is escorted through one of two access gates, and they are escorted by airport operations. They're met by security. They're brought up the freight elevator closest to that incident. They load the patient up, and they go down in reverse order. So it's a much more seamless process than before. And it's taking some of those medical incidents that were unfortunately in front of house and now put them behind the scenes a little bit, where not necessarily you need passengers looking to see what's happening with somebody's medical condition. So, that was a win for us with that. And that was just one example. Let's see what I have here. Initial planning efforts are underway to reconvene. As we talked about, we actually had our first meeting last week to update the plan. That was done virtually. And our goal is to hopefully continue those. We are continuing those meetings monthly virtually, but we hope to transition to that in person as we previously did before. Lots of lessons learned as we talked about. I mentioned the medical emergencies. We hope to have the plan completed by the end of 2022, and that'll put us out at the 3+ year mark, about 3 years, 6 months. If we get it done before the end of the year, it's a little bit longer than I would have liked, but obviously with COVID, this is our triennial year for Charlotte Douglas, so we have a lot of other things going on, but I think with all the partners involved, we can move forward and have an updated plan later this year. And I will add one thing that's not on the slide deck. So, as I mentioned earlier, having the plan or looking at the plan from the local EM perspective when I was there, and now is the airport EM perspective, you miss things from one side to another. And one shortcoming that we had, admittedly, was when we went through this plan, you saw the list of all of the partner agencies that were involved in the plan. And what was the one thing that was missing on that plan that you would think should be there? An airline. So when we did the plan originally, we're like, it really didn't resonate with us, if you will. We were very heavy on the public safety side, on the responder side, and the notification side. But all of this is being brought to us by usually an airline. So what we're doing, fortunately for this plan update, is we've engaged with American Airlines as our, Scott mentioned, they're the second largest hub here for Charlotte. So they are involved in this plan rewrite. And we've also engaged Lufthansa as well as a foreign flag carrier so that they can have their input in the plan as well. And you would think that it's something that's almost a no-brainer, so simple to have an airline involved in the plan. But admittedly, we missed that with the first go-around. But now we're correcting that. We're going to get their input to making sure what our plan says and does, it aligns with American, it aligns with Lufthansa, and if it doesn't, how do we meet in the middle so that they can accomplish what they need to, and we can do the same as well. So really, it's just a lesson learned as part of the process. So thank you for your time. Stephanie, I'll kick it back over to you.
Thank you, Michael. I appreciate that. So as you can see, I think Michael touched upon, if not all of the 10, a majority of them that helped him and his team be successful as they built a communicable disease plan specific to their airport. So hopefully you'll be able to take a lot of the information, either one aspect or all 10 or various levels, and implement that at your airports or at your aviation, within your aviation environment. We do have that ACRP synthesis. It's 115. It's called Practices in Airport Emergency Plans. So we have these items in there as well as a lot of the data. That's all I have. I'm going to kick it back over to Scott. I appreciate your time, and I believe we are going to now allow some time for question and answers.
Yes, we are. So Stephanie and Michael, thank you. Terrific presentation, great graphics, and you stay right on time. So we're in good shape. So let me encourage participants to shoot any questions you have of Michael and Stephanie on the question template there, and as I see them come up, I'll read them. But let me start by asking a question. I'm looking at your slides 16 and 20 and 25. The slide 16 was that mosaic of all the various departments that had to be involved in the plan, and slide 20 was the slide, Stephanie, where you talked about crosswalking multiple plans at the airport. And then, Michael, when you talked about the pandemic plan, public health plan, you mentioned 8 or 10 local and state and maybe even federal departments. So my question is this: does the research and your experience tell us anything about how airports think about their AEPs in the context of all these other plans they have to build, their crisis communications plan, their pandemic plan, their business continuity plan? They're all kind of connected. Did your research or your experience talk to how you think about coordinating all those plans together, or was that out of scope?
Well, I think that's where we got this successful practice, talking about an airport should look to crosswalk all of those multiple plans, because there is a lot of either duplicative information or complementary types of plans. So I think some airports are thinking about that, and they make an effort. If it's at least one plan that they know is pretty significant, they'll try to ensure that the elements within that other plan complements the AEP. So, that's something that I highly recommend to an airport, is figure out a way, whether it's by a committee doing it, whether it's assigning interns, whether it's bringing on specific help just for this task, but really take a look at how other people across the airport or in our municipalities are responding to incidents that can affect the airport. One of the things that I found when I was an airport emergency manager is everyone else seemed to talk about us, and they didn't necessarily talk with us. And so one of the ways we want to break down these communication barriers and issues is to have a seat at the table by either bringing someone to the table or taking a look at their plans, or vice versa, asking them to do the same.
Mm-hmm. No, that's very helpful. Stephanie, let me just ask you this question as well. When we go through the questions, one of our participants asked, could you land on the slide that shows the summary of the 10 points, your 10 findings? So that's in the background as we go through the Q&A. Thank you. She'll to the questioner there, we'll get that up on the screen for you. So thank you for that question. We have another question from the audience directed at you, Stephanie. You touched on how some airports view the AC, the Part 139 AC around AEPs as somewhat hard to get their arms around. The question is, did you discover any plans by the FAA to update the AEP format or involve airports in that redesign when they come up for their next kind of touching up of that circular?
Yeah, unfortunately, that wasn't something that we were looking at with this. We knew that it was going to be time at some point for an update. We just don't know when. And this synthesis ended up being published right around COVID time. So I know a lot of things have been pushed. The newest update has been with the UAS. So whether the FAA is going to loop back around and address the updates and include airports, I don't know the answer to that, and the synthesis did not address that as part of its scope.
Okay. Michael, directed to you, a questioner asks, with airlines being so multinational in their focus and have to interface their planning with so many different airports, not just in the U.S., but globally, have you seen any requests from the major airlines that are hubs there for standardizing to what they're looking for? Are they imposing any kind of standardization from their side, or are they just kind of coming to each airport and saying, what do you got? Let's see how we work with you. What did you see there at Charlotte?
Very much the latter of that. A lot of the information that we have here and all of our plans are available to all of our carriers and all of our tenants. And we have not addressed, or we have not seen at this point, the airlines coming to us and say, well, our plan says this and you really need to change this. I think it's a lot of just information sharing, and it'll be interesting to see as we work through this process with American and Lufthansa, what that actually looks like. Is there something that we need to change in the plan because it's in their plan that's different, and vice versa? Are they going to change something because we have it written a different way? But as of right now, it's more about just information sharing and making sure that everything is really tightened up as much as possible. Unfortunately, as I think with all plans, some things unfortunately do fall through the cracks, but we hope to address that early on. But for right now, it's and what we've seen, or what I've seen, is when these plans are made available to our tenants and our stakeholders and the airlines, they are more than willing to accept them and look at them, and they appreciate it. We're not trying to hide anything and not trying to get one past them. We just want to make sure that that information is there, it's in the right hands, and they know where to go to it when there is actually an incident.
Thank you. Thank you. Michael, let me stay with you for this next question. From the tactical to the strategic, if you view that as a continuum, you've got kind of role-based SOPs on one end, all the way up to what I would call a comprehensive emergency management plan on the other. And maybe right in between, you've got an emergency response plan. Can you speak to, or Stephanie, you as well, to how airports kind of view their AEPs on that continuum of, hey, I want it battle ready right now, simple as best, so I can respond with it, all the way up to, no, this is my Bible, it's 5 inches thick, it's not meant to be used kind of during an emergency. How do airports see their AEPs on that continuum?
From Charlotte's perspective, I look at it as somewhat of a college exam. You study it, you prepare for it, you know where to find the information. But during the heat of the battle or the actual emergency, you're not going to necessarily pop the back of the Tahoe and pull out your slide out tray and thumb through your plan and making sure it's there. You can certainly do that. But if the incident is very quickly evolving, you should know where that information is, what it contains. And our response agencies, our fire department, medic, and law enforcement, they have their own SOPs and SOGs. So, I'm not going to, it's not within my purview within the airport plan to say, okay, well, you need to double glove, you need to wear a hair bonnet, you need to wear coveralls. That's the SOPs and the SOGs from their response procedures. So whatever that works best for them, by all means. Ours is just that overarching, here are the notifications, here's how we're going to work this, here's where we're going to go, things of that nature. So it's really that delicate dance of what our overarching plan is and how it reflects to the agency's SOPs and SOGs.
Hey,
well,
Scott,
Michael, thank you. Yeah, please.
Oh, yeah, no, I just wanted to, when we speak to the synthesis, one of the successful practices that we saw is that, Michael's exactly right. You have your overarching plan that talks a lot about the details, the background information, but there are elements in there that are obviously very important to operationalize and move into a tactical response. And so some of those things is to create those checklists or pull out those checklists, develop reference guides that supplement perhaps that AEP, and you create that stakeholder book so that, as Michael said, you're opening up the Tahoe, you're opening up the response vehicle, you're in the EOC, you have your policy group somewhere. They can pull out those things that very quickly show them, even during different phases of the emergency, what are some elements they should be thinking about, what situational reports should we be developing, what actions should we be taking, so that it becomes much more focused. And that's how some of those airports have been dealing with that.
Oh, that's really helpful. Stephanie, staying with you. So from all the work you did on the census project, was it clear to you or not clear to you that an airport's best foot forward for effective AEPs is to have an emergency manager or someone who's a certified emergency manager in charge of developing and keeping the AEP updated? Was that a real indicator?
I think it is, because you have a professional who can focus their time, just like a doctor goes through years of education as well as practical experience. An emergency manager does that. They can either have the education and practical experience, or perhaps they've learned a lot of things through their practical experience. And this helps bring a different eye to how the plans can be organized and written, and different elements that should be incorporated. And it helps lead to more capabilities-based planning, so that we're looking at what is the capability that we need to have in order to be an effective responding organization, such as evacuation, such as managing patients and transporting them, such as having areas of refuge or sheltering locations if we experience a tornado. All of those elements, emergency managers, that's what we do. That's what we look at. That's our job. And we're also typically collaborative in nature, or we learn that we have to be. We can't do it all ourselves. And oftentimes we know a lot of different things at a very superficial level, so that we need to bring in others who have those expertise. We know how to find those people, or we learn how to, we build those relationships and we learn what information they have. And so bringing a professional emergency manager on board, I think, helps not only professionalize the aspects of preparing for disasters, accidents, emergencies, even special events that you might have, but it also allows someone to be there to take on this role and focus their energy and efforts on it versus an ancillary duty, if somebody can do that. Mm-hmm. If somebody's not able to hire an emergency manager, then I highly recommend go through some classes for someone, learn some of these steps for emergency management to try to incorporate.
No, that's really great. But let me ask a follow-on question. If emergency managers by their very nature are collaborative, how do you deal with folks that should be touching the plan who aren't collaborative, who didn't choose to get involved in developing the AEP or updating it or sitting through a tabletop exercise, and now you have an emergency? How do you think about ending those communication breakdowns when there are people at the airport that weren't so collaborative on the building side?
Absolutely. It's a great question. I know I experienced it when I was at the Airports Authority, dealing with Dulles and dealing with Reagan, as well as corporate offices. And I know Michael can also speak to it from his experiences. But what I found, and this is one of the things we talked about, is you help answer the question, what's in it for me? You say, here is why this is important for you, or you listen. A lot of the time you ask questions about why they're hesitant to be involved. Is it a time issue? Is it an interest issue? And that allows you to at least try to come up with some solutions. Or frankly, I've had these conversations, you both recognize that one person is just never going to want to engage in the process, and you're just going to have to work around that. And so I think a lot of it has to do with one-on-one conversations. I've had to do that myself, where you listen. You ask the question about what their level of engagement is, or what do they want, and then somewhat going from there, and then helping them understand that during a response, how can they pay it forward to help others come behind them? You know, what if one day we all win the lottery and we all leave? It's those people who come behind us that we want to leave that legacy for. And so finding those key elements that is important to that person who may not be so engaged or doesn't want to engage, I think that's where some efforts come in to try to be collaborative with them.
Okay, thanks. That's really great. Hey, we have one more question from the field, and I think that's more of a question to me since I was involved in building this. How does an airport operator access the AEP builder? So to that questioner, I'll try to get to you offline if I can. If you go on the TRB website, there should be a kind of an opening portal, online portal that gets you into the report. It was part of ACRP 04-19. That'll help you find it. And you'll go from that portal right into the web hosted portal that's hosted in the cloud. And you'll be able to sign up as an administrator, sign up other administrators and users, and then go through the survey. So if that's helpful, I hope that's helpful. If not, please reach out to either Stephanie or Michael, since their emails are shown here. And I'm not sure if mine is shown or not. If it is, yeah, please reach out to me. My email's there, and I'll be glad to send you information on that link through TRB that gets you into the AEP builder. Hopefully that answers your question. I don't see any other questions online. Can I encourage everyone who's still listening? There's 104 of you there. If you have any other questions, please type them in. We'll give you a minute or two to type them in. And if I see something pop up, I'll read it out. And if not, we'll assume that this was such a good webinar that you learned everything you need to know about AEPs. All right. Well, Beth, it doesn't look like there are any other questions coming up at this point. We've gone through all of them. So from my perspective as moderator, I'll turn it back over to you to close us out.
Great. Thank you very much. Thank you also to Stephanie and Michael for the presentation and the discussions today. We do have other research and webinars that you may be interested in. Please feel free to check that out. I'd like to thank everybody for joining us and participating. When you sign out of the session, we do encourage you to take a brief evaluation regarding your experience, and TRB uses these evaluations to improve our webinar program. Your feedback is greatly appreciated. Last but not least, please make sure that you have subscribed to TRB's weekly newsletter. The subscription process changed last year, and you might need to make a few updates. Have a great afternoon, and we hope that you can join us again in the future for more TRB webinars. Thanks, everyone. Bye.